This video will outline the various stages in the usage of the Celltrans post-operative autologous blood transfusion system. We'll follow the product from its setup in theatre through to the collection and reinfusion of blood in recovery and on the wards.
So how are you feeling now?
Before using any autologous blood transfusion product, we recommend that your hospital writes a protocol. One of the most important factors for consideration is that the blood salvage site is sterile. Bowel surgery, for example, may not be appropriate. Another important factor is that you must not start the collection of blood for at least 20 minutes after the wound has been closed or the tourniquet released. Any attempt to do so may result in the blood clotting in the Celltrans device. During this period, the blood defibrinates. That is to say, the fibrinogen and platelets required for clotting are used up in the wound. Each section of the video is colour-coded, so you can identify which part is relevant to you. The blue section describes the initial setup which takes place in theatre. The green section describes the collection of blood which takes place in recovery and on the wards. And the red section covers reinfusion, which usually, but not always, takes place on the ward. The Celltrans device is double-packed and it's supplied in a transit pouch. All the packaging is clearly labelled with the details of the product, including the drain size, the batch number and the expiry date. Open the outer Celltrans ABT device packaging using aseptic procedures and transfer the sterile inner wrapper to the sterile field. Inside the bag is a set of sterile instructions that can be referenced by the perioperative practitioner if necessary. Inside the sterile bag there's everything required for theatre setup. 2 blood collection bags, the bellows to create the vacuum, and 2 trocars with drains. To set up the device, firstly shut the red clamp on the patient line. Compress the bellows and hold. Close both of the white clamps on the transfusion bag ports. Attach both transfusion bags onto the ports below the bellows. Do not remove the paper ties on the bags at this stage. Depending on the requirement, the surgeon will insert either one or both of the drains. Cut off the trocars at a 45-degree angle and connect the drain to the inlet tubing via the universal Y connector. Make sure you cut the Y connector to fit the size of the drain being used. Fill in the patient's details on the blue bellows tag. You should note down the patient's name, hospital identity number and the time that either the tourniquet was released or that the wound was closed. Ensure that the pinch clamps are closed on the device and that the transfusion filter is sent in the transit bag with the patient to recovery. The second stage in the use of the Celltrans ABT device starts in recovery and continues on to the ward. Hang the Celltrans ABT device in an upright position using the bed rail strap. This must be below the level of the patient's wound. Tear off one of the paper ties and unroll the transfusion bag that you're going to use. Enter the patient's details on the first transfusion bag along with the time and date at which collection began. Check the time of the tourniquet release or wound closure from the details on the bellows tag. Collection must not commence within 20 minutes from this time. After the 20-minute period has elapsed, open the white pinch clamp on the active transfusion bag. That's the bag that you've unrolled, and the red pinch clamp on the drain line. The AABB guidelines state that you can collect for a maximum of 6 hours from the time when blood collection commenced. You may transfuse sooner if 600 millilitres of blood has been collected. Regularly check the drain to ensure the bellows are still creating a vacuum. If they have fully expanded, you'll need to reprime them. To do this, close the red clamp, fully compress the bellows, and then open the red clamp again. The device does work at a passive vacuum, so the vacuum level never goes to zero. We always advise repriming regularly in order to optimize the vacuum level. When the first bag is full, close the white clamp and the slide clamp on the bag itself to seal it. If collection is to continue, set up the second bag for collection. Tear off the paper tie and unroll the bag. Enter the patient's details, along with the time at which collection began, onto this new bag and open the white clamp. Finally, remove the first bag and cap it. You should never collect into more than one bag at a time. Cap the outlet. This outlet cannot be used again for the collection of reinfusable blood, as it's no longer sterile. You must not allow the transfusion bag to overfill. Remember, 600 millilitres is the maximum. If the bag fills, or if the patient remains in recovery for more than 6 hours, it may be necessary to start reinfusion. If you need to use a third bag, attach this onto the transfusion bag outlet that was last used. Because sterile conditions cannot be maintained, a third collection bag must only be used for drainage and must not be used for reinfusion. Do not retransfuse beyond 12 hours of the tourniquet being released or the wound being closed. When using a third bag, we recommend that you use the Summit Medical Replacement Collection bag. When the patient leaves recovery, send the transit bag with the transfusion filter along with the patient to the ward. Here are some key points to remember about the collection stage. Make regular checks to ensure that the device is maintaining a vacuum. Reprime if necessary, closing the red clamp first, then squeezing the bellows and reopening the red clamp. Only collect into one bag at a time. Don't overfill the bag. The maximum capacity is 600 millilitres. Change to the second bag after 6 hours. When the bag is full, or if you've been collecting for 6 hours, the AABB guidelines recommend that you start reinfusion immediately. The final stage in using the Celltrans system is reinfusion, which can begin when the required amount of blood has been collected or the 6 hours time limit is approached. Remove the protective cap from the filter spike while maintaining aseptic conditions. Turn the bag upside down so that the butterfly port is at the top. Twist off the butterfly spike port on the transfusion bag and spike the bag with the transfusion filter. The bag has a membrane that requires piercing. Remove the end cap from the infusion line and squeeze the bag from the bottom to expel any air before wetting the transfusion filter. The filter must be primed according to the manufacturer's instructions, which you will find in the pack. Set up the bag on a blood stand as normal and reinfuse according to your hospital's protocol. You must use a new transfusion filter for each transfusion bag.
Yes, I would enjoy a cup of tea.
Here again are the key points to remember when reinfusing. Holding the bag with the butterfly spike at the top, twist off the spike port and pierce the membrane inside the port. Spike the bag with the transfusion filter. Remove the cap from the end of the line. Squeeze the bag from the base, expelling any air to avoid air embolisms, and thoroughly wet the filter. Set the bag up on a blood stand as normal and reinfuse according to your hospital protocol.
So how are you feeling now, Andrew?
Remember, post-operative autologous reinfusion using these detailed procedures is a safe option for the patient, reducing the risk of cross-infection and incorrect cross-matching. It's a simple, safe and effective method of blood transfusion.